Hey, I'm Liamith,
My name is Jay, and welcome back to the Medical Frontier podcast.
where we talk about today's inventions, which are tomorrow's standard of care.
Yeah, so in this episode, we wanted to talk a little bit about vital signs and how there's new technology being released to measure vital signs continuously, and how important these signs are, and what physicians can learn from these signs, and how these are great indicators of a patient's health. And so the technologies that we wanted to talk about today is called the Accurate 24 BPM FDA approved monitor. So what it does is basically it monitors your vital signs, so your respiratory rate, your heart rate, your blood pressure, and your body temperature. And there's different ways to wear it. So you can wear it like on your wrist, kind of like a watch. It's like about this big that you can wear. It's got like a screen that tells you those measurements, and you could also wear it as a lanyard, and it tells you those vital signs, and it's a continuous monitor as well.
Yeah, so with that, right? Going back to vital signs. So going back to all these things that are being measured by this. The first thing when you go to the doctor's office, what they do after your height and your weight are these things. These things are key indicators of your heart health, and many different things can be understood by the way your heart's beating, right? And
Mhm.
there's so many different aspects that you wouldn't know unless your blood pressure is measured, right? Because if you have a higher blood pressure, if your heart's pumping a lot, then you can say, okay, maybe you have too much cholesterol in your body. Maybe you have potentially, God forbid, what is it? I'm blanking. A plaque buildup
Yeah.
in your arteries,
Mhm.
right? So all these different things that can lead and tell a doctor and catch something ahead of time and say, okay, like you need to cut back on all your junk food and your cholesterol and potentially extend the years that this person is living life. And you know, high blood pressure is something that is very, very, very crucial. I think like, we previously talked about the brain being an organ. This is second, in just the way your body functions, right? Like if the heart pumps oxygen to every single organ in your body, like every single thing is even your brain. If you don't have oxygen to your
Mhm.
brain gets damaged and ultimately like they go hand in hand, right? So it's essential that your heart is healthy and that this heart health is maintained, which is why your blood pressure is taken every time you go to the doctor, right? So it
Mhm.
just makes it even more important for that there should be, an effective way to monitor this and whatnot, in the most effective manner. And there's also heart disease, right? There's uh decreased blood flow to the heart, coronary artery disease, which affects the blood flow to the heart, and decreased blood flow can cause a heart attack, right? Nobody wants a heart attack. Nobody wants a heart attack. So,
Yeah.
yeah, that's where I am with the basics of vital signs. You want to head into the technology more what Accurate 24 is.
Yeah, so Accurate 24, like I said, measures like the respiratory rate, heart rate, blood pressure, and the body temperature. And you were talking about the importance of blood pressure, right? And I think a huge testament to how important your heart is that while your brain sends neurons and signals, these electrical impulses to like your muscles and other parts of your body to control your movement, your heart is composed of cardiac muscle. And cardiac muscles don't actually need um, impulses or signals from the brain to tell them to beat because they're that vital, right? So even if your brain is not functioning at its optimal level, your heart is still beating because it has those AV, its nodes that it uses to create its own electrical impulse and keep the blood flowing throughout your body. So blood pressure is one of the most important things, like you said, because if those plaques build up in your arterial walls, it can, cause shortages in the walls, and that's actually what causes high blood pressure. And I'm thinking about ways in which this technology, like this monitor, can be useful. So, let's say if someone is an older patient, and if they need or if they've experienced some heart conditions before, they might need the or have the need to have their continuous vital measured, right? So, if a physician or a first responder comes in, they have their vitals, what's going on their arm, ready to go for them to be measured. And also, they're obviously just gonna double check those vital measurements. They're not only gonna go based off of what the monitor is saying. They're obviously gonna double check them. But having that baseline or having that number just to see
Right.
can be a huge first reference.
Yeah, and I think counter argument for a lot of this would be, okay, I have an Apple Watch, I have a Fitbit, I have all like what's the difference, right? Like, but
Mhm.
I think, as you said, something that's important is that with technology, right, it gets very confusing very fast. Somebody who doesn't have an Apple Watch, who doesn't have a Fitbit, may not know how to operate it to get to the vitals quick enough or soon enough. Again, time is of the essence. That's another thing that we're going to keep emphasizing on the channel. And seeing that and being able to respond to that in a timely manner is the only thing that's going to help. Sitting there and like while the patient, suppose, God forbid, the patient's unconscious, like sitting there and going on their Apple Watch and clicking through, trying to see like, okay, like what was their history? Like, come on, like you see it on site,
Mhm.
on go, and then an action plan gets sprung into play and the ball gets rolling. And when you have that ball gets rolling, the sooner the ball gets rolling, the better in every scenario. And I think
Mhm.
just the simplicity of this technology and the accessibility to wear it around a lanyard or to wear it on like on your skin, I think that provides a lot of it provides a lot of help and a lot of security too, because that constant monitoring, right? Suppose let's apply this situation to nursing home patients. There's a lot of elderly people in those homes. There is only so many caretakers. If there is a situation where, their blood pressure gets too low, because that's common in elderly patients, um, they could see it immediately and make a play, because you can't ask everybody, you can't monitor everybody, but like you can see something and say, okay, like are they acting normal? Like is anything wrong? Is it different? And you would also be able to understand their like typical like heart rate. If it's a monitor, right? You
Yeah.
see something over and over again, you say, okay, it's always in this range. And if it's out of that range, then you know something's up. So like I think that too, and I just think it's a great thing. I think particularly I would target this device towards more elderly patients than anything, but it's
Mhm.
very applicable to I think all walks of life. And because again, right, with that simplicity of the technology, that's why it makes it accessible to older people, whereas Apple Watches and whatnot, there's that barrier again.
Mhm.
So like to learn that technology and have that digital literacy. But
Mhm.
besides that, yeah, I think that this would be, I mean, if I was a, you know, pitch of this product, I would pitch it to mainly elderly people.
Yeah. Another thing is that it can be useful for, if you're going on a hike and you need,
Right.
continuous measures of your vitals. If in case something happens, then you
Right.
want to have just, like a baseline of what's been going on. That's another way it could be helpful. But, there's a lot of people that can be using this. So I would specifically say people that are having heart conditions, right? So heart disease, if they're in the risk of cardiac arrest or heart attacks. Um, Oh, and there is a big difference between those, by the way. I feel like it's important to explain the difference between a cardiac arrest and a heart attack. A attack is a circulation problem. So, like we were mentioning, with a heart attack, it's when those plaques build up in your arterial walls, and it actually constricts the amount of blood that can flow through the artery. So, if there's less volume if there's less volume or surface area for the blood to flow through, then it creates, high blood pressure in that area, which is not good for your heart, as it's, pumping hundreds of gallons of blood every single day, working or tirelessly to be doing that. And then a cardiac arrest is actually a electrical problem. So in your heart, you have your SA and your AV nodes, your sinoatrial node and your AV node. And the sinoatrial node is what initiates that electrical impulse to actually beat your heart, which is called the lub dub sound, like the when you're when the heart is actually pumping, the sound you hear. And the electrical problem is what a cardiac arrest is. But symptoms of heart disease include arrhythmias, heart attacks, heart failure and things like that. And then there's a lot of risk factors associated with that as well. So we can talk about diabetes, like we talked about, went into detail in our last episode about a couple episodes ago, and then overweightness and obesity, which also plays a hand in heart attacks. And, that has to do with your diet and physical inactivity and things like that. So there's a lot of um, patients that this product can be applicable towards.
Right, yeah. And again, the emphasis on the importance of the technology. I know in the past we've covered things like heart in the box and whatnot, but I think lately as we've kind of shifted our channel, we've seen that this is like a more public health issue, and it's something that's applicable to more people. So it's something that's really, really important, right? Because this is not, okay, I'm having a heart transplant, heart in the box. This is everybody has a heart, whether you believe it or not. Whether some people are cold-blooded and cold-hearted, that's a different story. But
Yeah,
everybody does have a heart at the end of the day. So when that happens, there's literally applicable to everybody. Like, can't
exactly.
emphasize it enough. And I think catching early on signs of things, because there is a story that I'm gonna play in this situation here. Obviously, this is a de-identified person, but this is somebody who like they were an adult figure in my life, not in my not family or anything, but and they told us this story. It was me and a few of my friends, and they said that they had chest pains when they were in their teenager years. So they had chest pains, and this individual went on to ignore those chest pains at the ages of 12 and 13, um, all throughout their teenage years. And then they went to a football game. And they went to a football game, I think it was Florida against Georgia, and they collapsed. They collapsed and they had a heart condition of arrhythmia, and they never knew of it. They never knew anything of it until they had a heart attack. They had to have CPR, their ribs broke. They're obviously okay now, but they had to have that experience, and it's like hearing that scared the crap out of me. Like, because you're telling me like you can go your whole life or like however long, and you don't know that something's wrong with you. It's like, what can I do so that something similar doesn't happen to me? You know,
Mhm.
because there's so many situations where there's undiagnosed heart conditions that, like, even in All American, like Asher Adams, for example, I think his was because of steroid use, but regardless, like he had a pre-existing heart condition too that was worsened by steroid use, but he didn't know of that until he was like 17, 18 years old in his senior year of high school. So having this heart monitor could potentially, right? It's obviously not an EKG. It's not all that, but just, having those periods of times where maybe like there's elevated heart rate when there's not supposed to be
Mhm.
and things like that. And you can also like you could use this as a trial run, right? You could see like, okay, because you're constantly like wearing it, right? So you could have your diet for a week this way and then see if your heart performs better. See if your
Mhm.
heart's more healthy, if the blood pressure is like the heart rate is lower and it's not as high and whatnot like that. So I think it's like really applicable, and there's just a lot of different advantages and utilities. Like this could be used in clinical trials, clinical studies. And again, the simplicity is what really draws me to it, right? The
Yeah.
simplicity of having that on call, on demand, without having to orient anything, without having to navigate through any type of digital technology, low digital literacy, effectiveness, um, FDA approved, all the all the bells and whistles. But yeah.
Yeah, that's a huge thing that you mentioned about, like that experience that you had with your friend. And, something I like to think about is that monitoring your heart rate is not just a number. I would consider it kind of like a window into your entire cardiovascular health. What do you think about
Mm,
that, right? And then
yeah.
your cardiovascular health is so important to like the rest of the way your entire body functions. So, knowing those numbers, it's not just, seeing a number, writing it down, or like your provider not just writing it down. It's actually an indication of how your heart's doing, how it's pumping blood, how the rest of your body's functioning. And the way it does is through multiple sensors. So it combines piezoelectric sensors. So I'm wondering if I'm saying that correctly, but it's
Mm,
called a piezoelectric sensor, and it also has optical sensors. So the piezoelectric sensor measures mechanical changes in the body, like your heartbeat. So it actually, like the moving components is what it tracks. And then the optical sensor uses light to detect blood flow, like through your arteries and veins. That's
got
how.
it.
Mhm.
Got it. Yeah.
And
That's
another great thing about this is that, it uses no cuffs, right? When you think about a
mm,
BP monitor, you think of like going into your care, and then they have like that BP cuff that they have to put around your arm, and they have to align it to your brachial artery and make sure it's like those two finger links above and whatnot. But
right.
this actually uses no cuff. And think about how useful that could be to, like maybe like a little kid that might be fussy about not wanting that, or maybe someone else that has like, an injury to that part of the arm or on both arms that they can't, be wearing that cuff. So it just
Yeah.
makes it much more applicable for people to be using.
Yeah, no, I completely understand and agree with that. And I think that again, I think we just can't emphasize enough that the accessibility and the reach of this product could be to do so many different walks of life, so many different situations. It's
Hmm.
just so simple, so small, so convenient.
Yeah.
Um, but it honestly, like, it kind of, I was like, I um was thinking like, does it perform the same if it's on a lanyard or if it's on your skin?
I would think it might perform a little bit differently, but I'm not too sure. I've only seen like the actual wrist variation. I haven't actually
Mm-hmm.
seen the lanyard variation, but assuming that it is FDA approved and they have, run clinical trials on, and it has passed clinical trials with passing criteria and validation, I would assume that it runs like pretty similarly either way. They've done like Bland Altman analysis, they've done Pearson correlations with it, and it's passed all of those. So it has a mean error magnitude of less than 5 mmHg, which is the unit, and then the standard deviation of less than 8 mmHg. So I would assume it does work pretty similarly in both variations.
Got it. No, yeah, that makes sense. That's awesome to hear. I think that, again, we found another device that could be accessible, and I want to hear some feedback from you guys. I know, like we've kind of deviated from the way that we've talked about medical technology. Would you guys rather us talk about the public health issues? Because I feel like that's a lot more applicable, and I feel like that might be a lot more interesting to hear about and to hear our perspectives on that through our experiences and through our walks of life. But
Mhm.
if you guys want us to revert back to, the OG, crazy medical technologies that we were able to find, we can definitely
Which
go back
there's
to
so
that as
much of,
well.
by the way. Yeah, there's just so much of those too,
Yeah,
and there's there's always new things being developed every single day, to be
always.
honest, I would think, and you know, the rate at which these advancements are coming up is just remarkable. The way that so many people are coming up, putting their brains to work with so many of these devices, just trying to, help humanity in any way that they can is a huge feat, but they're doing it at a remarkable rate.
Yeah. Yeah, no, they really are. And well, I mean, yeah, I mean you wrapped it up pretty well, man. I think you said everything that needed to be said. But yeah, guys, I think that this was a great discussion. I really did learn a lot again, doing research for this topic, and Jay kind of took the reins on this one and then was able to find this, so I'll give him all the credit for that. But yeah, it was a great episode, and we're really thankful to continue to do these episodes. And any last remarks, Jay?
Yeah, like Liamith was saying, just if you have any suggestions for other technologies or other topics in healthcare that you want us to talk about, just leave those in the comments, and we will try to do research on those, learn about those, and spread the information to you guys and knowledge. And hopefully, you guys enjoy spending that time with us and learning more about the field.
Yep, definitely. Thank you guys for watching once again. We really do appreciate you taking the time out of your day, and we will see you guys next time.
Yep.
Peace.
Thank you, guys.